Good morning, sir.
Good morning.
As you've been a part of Sir Gangaram Hospital for a long time and you are taking care of GRIPMA, which has also been the cornerstone for the hospital, and you've been a part from the times when medical was not so advanced. But today it's the time of robotics, AI, technology. How do you see the future? And how do you see that GRIPMA will be taking this forward for the coming generations?
I think all these newer technologies which are coming up will transform the health sector in a major way. Diagnosis will become much more accurate, and planning treatment would become much more well defined. More importantly, we expect all this will result in better outcomes for the patient.
All right, sir. So another thing is that how do you see your curriculums will be changing in the future academics for DNBs or fellowships with this technology coming in?
I think it's a very important question, and I think we have to be future ready. Future is actually knocking, and if our resident doctors are not using these newer technologies, they will get left back. And there is no reason for them to get left back because we have all the tools and resources in our academic wing, that is GRIPMA. We have all the resources, and we encourage our resident doctors to use those resources which are available. Like we have online platforms of clinical key, remote access, and up to date, which make available a huge repertoire of knowledge to our residents. And I think we from time to time keep on doing some seminars and symposia, writing them about the likely scenarios of the future. We do hope that in the times to come we'll be taking major step towards integration of AI in our curriculum, and from that I mean that we'll be holding some symposium and seminar as to how to utilize AI in a better way. At the national boards level, which is the controlling authority as far as the DNB program is concerned, they have come out with this very important initiative, and they are doing a seminar on AI in healthcare. So we do hope that our residents will be able to join these programs, and they get future ready. In today's time, I think if you do not know how to use the technology, then I think the onus is on a particular individual. So at the individual level, I think they should be motivated, and at the institutional level, we should be encouraging them.
Lovely, sir. You being heading the GRIPMA and taking this legacy forward, I'm very sure that Sir Gangaram Hospital GRIPMA, as a part of education, will be taking this forward to create more future-ready medicos and the consultants. And I believe that there will be a lot of practical knowledge which will also be involved when we talk about AI, because that's technology. I always believe, and I would love to hear from you, that you cannot take the physical part of being in medical or a medicine or a consultant, because human touch is very important.
Yes.
So how to balance that, if I would
You
love to
see,
hear that.
AI will be an enabler, but will not substitute the doctor.
Yes.
At some point in time, starting from initiating the interaction between the patient to the healthcare, and to taking the final call about the patient's treatment, all of this would have to have a human interface. It cannot be replaced as of now, and I do hope that our people are ready, our resident doctors are ready, our community is ready to understand that AI is an enabler, and using AI in a proper manner as per the guidelines would be the way forward. In this context, I think it will be very important that we'll be becoming more accurate in our diagnosis, but our final diagnosis will always require a human trained person or a medical professional to validate what AI has come out with. It will be, I'll not be remiss if I were not to mention here one particular individual who suffered devastating complication following self-medication as per the AI advice. Recently, it is in the public knowledge that one individual he felt that probably he has acquired AIDS and took some preventive medication for AIDS without knowing the side effects and all of those things. And unfortunately, most of the medications are available in our marketplace over the counter. So he was able to procure the medication and suffered devastating complication. He's fighting for life in Willingdon Hospital or RML Hospital. So I think it's very important that such a scenario should be prevented at all costs. And this could have been prevented if he knew that AI is not a doctor but a doctor's assistant.
Thank you, sir, on this. I look forward to have much more coming from Sir Gangaram's Gripma, and I'm sure the future is bright.
Thank you so much.
Thank you so much.
Thank you.
Thank you.
Science is developing at a very fast pace. The faster it goes, closer it comes to what we already knew and we call as spirituality or spiritualism. Climate change, biodiversity, things everybody knows. It was known already that we live because other organisms also live. Science says gut microbiome, science says plants, science says touching animals, caring for animals. So all these things were known to us. They heal us, they enhance our health by providing their good bacteria, the microbiome, to us. So microbiome is the foundation of health, and foundation of microbiome is biodiversity. Touching and caring for everything, everybody, everywhere around us.
Good morning, sir. Welcome to the
Morning.
CME of 2026 of Sir Gangaram Hospital. Today you spoke about Bhagavad Gita and the science of healing. So I'll ask you a very small little question related to that. Do you really think science enables spirituality?
Thank you very much for asking me this question. It is a hard science based upon data that spiritualism is nothing but our current knowledge into the science of our bodies working. Now, in highest impact journals in Western world, because we take guidance from West, they have shown that meditation or influence of music improves our brain output. They have studied it from PET scan based on MRI functional study that 95% of our brain is default mode network. They call it default mode network. What we call shaitan ka ghar, khali dimag shaitan ka ghar. Only 5% of brain which is functioning gives us positive healing or positive feelings. So the role of spiritualism is in diminishing this 95% shaitan ka ghar, khali dimag or default mode network. So when it decreases, our output of 5% increases. Initially, we used to think that we are using only part of our brain, so we can use more of it. But science never understood it. It's spiritualism, spiritual basis, which told us that 95% is always working, wandering brain, shaitan ka ghar. Spiritualism brings that activity down so that the 5% which were working becomes more effective. Scientifically, we call it positive diametric output. So that increases. So spiritualism means here meditation, mindfulness, music, calm atmosphere, chanting of a rhythmic musical note. We call it mantra, or you can have a song which is rhythmical. So it has hard data of science to support all this.
So when you call spirituality, or when we talk about spirituality, now with AI, technology, future-ready technology in medical, when it's coming and we are getting into the phase where we are going to go more techno, as we say in today's language. How do you see the amalgamation of both?
Yeah, another good question. We call it singularity. Singularity between science and what we already know. Call it spiritualism, ancient wisdom, culture, civilization. So it is all coming together, and machine learning and artificial intelligence is expediting it. For an example, in a laboratory research, what used to take us months and years to cells to grow in a culture, now artificial intelligence can do those calculation in split second. So the enhanced scientific equation or formula which appeals to a scientific mind can be generated for things called ancient or civilizational or cultural or spiritual, so that we understand them faster. The equation is made by AI. Aristotle said the facts that we do not understand, we call them philosophy. Once understood, we call it science.
Science.
So AI is creating this equation from facts not understood to facts understood. So there is we need a formula. We know this happens, so this will happen, this will happen, this will happen. So that process is shortened now. Otherwise, human mind was taking years and years. We used to see generational change. And we will say something was negative in older generation, but a generation later we'll say no, they were right. For example, the largest and oldest scientific study on health is known as Framingham study. Framingham is a place near Boston. It started in 1948 and it enrolls people from the same family. Like grandfather was studied, then father, then son. So 4 generations have been studied to see the effect of atmosphere, diet, thinking, and what we call as lifestyle. So we are all aware, we were told when we were growing up, ghee is not good, oil are better, refined is best. But on that basis of Framingham study, in 48 they told us this. Now the same study is telling us, no, we were wrong, ghee is better, refined oil causes cancer, things like that. So AI and machine learning is reducing this gap, not 1948 to 2026. So it has 78 years. Now this thing can be done in 0.78 seconds. So data is already there. It is a question of analysis.
Thank you, sir. On this note, I believe that being a country which is so spiritual will bring along AI and technology put together, and we'll be healing better. Thank you, sir.
Thank you. I think it is, we were intelligent. We were not spiritual.
Okay.
Now we understand spiritualism
more
as intelligence. We respect our ancestors.
Thank you, sir.
Thank you so much.
Thank you so much.
Yeah. I am Dr. Pankaj Garg, Vice Chairperson of Department of Neonatology, Sir Gangaram Hospital. And today at Sir Gangaram Hospital CME, we are looking at smarter ways of improving healthcare. And my work is to take care of these extremely preterm babies. So my motive is smarter way of saving those intact without morbidities, without intellectual delays, so that they are able to live a normal quality of life.
Good morning, Dr. Pankaj. Welcome to the CME of Sir Gangaram Hospital 2026.
Thank you.
As we are talking about smarter diagnosis, innovations, technology, I just want to have your idea where you are taking care of neonatal, right? How you think is the future of technology in a smarter diagnosis and innovation and techno-driven clinical medicine, wherein you can bring technology and that amalgamation of your medical sciences and technology come together to take care of your discipline?
So when we started doing neonatology 30 years back in Gangaram Hospital also, we were hardly saving babies who were less than 1000 grams. Now these are extremely preterm babies. It's only because of technology which is there in Gangaram Hospital over the last 30 years. Now we are able to save around 80 to 90% of babies who are born less than 1000 grams. Technology has really helped. Now once these babies are born, we make sure that they are born in the hospital. In utero transfer of expectant mothers is done. Mothers are better taken care of. At the time of resuscitation, the first hour of birth of these preterm babies is extremely important. How they are taken care at birth, we do delayed cord clamping. More blood from the placenta goes to the baby. That is something very, very simple, cost-effective strategy which has been employed over a period of time. How to take care of the temperature of babies at birth. We have specialized cold, hot mattresses, hot caps, plastic wraps, so that as soon as baby is born, the baby is born very, very thin skin. A lot of water losses and temperature losses there. We make sure that does not happen. As soon as they start into breathing difficulty, there are specialized machines which are called TP resuscitators, so that babies' lungs are inflated right at birth. We give surfactant in these preterm babies' lungs so that their lungs get expanded. We give them caffeine so that they keep on breathing. we shift them to incubate through incubators, which were not there 30 years back. Incubators are specialized machines in which temperature is maintained, even the ventilation is being done. They are shifted to NICUs where the care continues. So this is the continuation of care. We make sure that babies are not hemodynamically disturbed. Every investigation which used to happen, that baby used to go to CT scan department or ultrasound department or echo department to get the investigation. Now everything comes to the NICU. PDA ligation surgeries are done, ROP surgeries are done, echoes, everything is done in the NICU. This is technological help which has been make it possible to help. Also, we have been very humanized now. We are taking care of babies in such a human way that babies are not disturbed. We do cluster of activities, temperature control, light control, noise control, involvement of parents, kangaroo mother care, and powering the parents so that they are able to interact with the children in the NICU, and the same care is continued once they go outside. So all these things have been possible only we have adopted to technology, and we also not only adopted them, we have adapted to our Indian standards. Our Indian parents are excellent. They are involved in babies' care from very beginning. So mother's milk is provided to them. We are going from parental nutrition to enteral nutrition. We are giving mother's own milk. Mother is involved, and then these babies are screened for eye issues, for hearing issues, for developmental issues, metabolic problem, so that once this baby goes home, which may be after 1 month, 2 months, 3 months at times, they are going home survival, and they are going home in a healthy way. They don't have chances of cerebral palsy, developmental delays, and issues which can bother them later on in life. We keep on following them, they come to us so that we see if there is any difference in their development happening, pick them up early, manage them at early. So technology with a human mind and human heart has made the intact survival of premature babies possible.
Sir, a next question coming from what you said. Do you really think any time a human touch or a human diagnosis can be taken away by AI? That's, I think, a question which I would love to ask you.
So AI will be helping us, but it will never be able to take care, replace human touch. So suppose a baby is born to a mother. The mother is there, hold the baby against the skin. So AI cannot do that. Involvement of parents, their father, grandparents to talk to the baby. So that AI cannot do. Providing milk, breast milk. How will the AI provide milk? Providing nutrition, care, and continuation of care will be there through human touch only. Yes, AI can help us in making guidelines, whether this can be done better way. That all will be there. So I think over a period of time, AI will be there always, but human touch cannot be replaced.
Thank you for this question, sir. And I think our future babies are very secure with doctors like you. Thank you so much.
Thank you.
Well, I welcome you to the 15th annual Sir Gangaram CME, and which has been worked for last 17 years, barring 2 years of COVID. We've been doing it regularly for the benefit of all the general practitioners and learn from each other, essentially speaking. So the topic is basically we have kept our focus more on the newer technologies. So it is sharper diagnosis and smarter management, so that we know that what is happening into the world right now and how AI is affecting everything, how we can do it in a better way, how we can help the patient and the physicians around to do the easy diagnosis, do the sharply working it out, so that we can give better results to our patients.
Sir Abid. Good morning, sir.
Morning.
So very interesting your session was. From there, I just want to ask you one question.
Sure.
Today, technology is taking over everything, and we talk about AI, we talk about sci-fi in today's language and innovation. I just want to understand that how sound therapy and technology comes together as an enabler of healing.
Well, the sound itself is a great healer in itself. And if you look at the age-old wisdom, the genesis of the universe was with sound and with a vibration. And we, in our own system, that is Indian Vedic system, we knew that thousands of years ago. And that is why we developed ragas, we developed the rasas, and at the same time, realizing we had different rags for different timings, different months, different seasons, and different moods. So the thing is, we could control. And now the Western world has started becoming very much interested into it. So, there is a lot of research on the primordial sound, that is Om. And it has been now known through the studies in Harvard and many other universities that it calms down the personality, it lowers down the blood pressure, it eases the person. So overall, it always gives you a better quality of sleep as well, which is very, very important for developing basically, say, the immunological system of the body, resting, memory consolidation, and interplay so that the brain has newer connections and it is rejuvenated all the time. Now, coming on to the basically the AI part, or maybe the technology part of it. Since that has been happening, today we have got a power to modulate so many things. Even the voices can be, one singer can sing in some other singer's voice. But having said that, that is an over extrapolation, but it can definitely help us in developing these things. We can create newer things, we can create near algorithms, and that will help the patient, because music in itself, music or sound primarily, they are themselves great healers of body, mind, and soul.
Thank you, sir. So, sir, another question which is I'm trying to ask everybody. Do you really think AI or technology can take away a human touch or diagnosis?
Certainly not. The reason being, the importance in the overall scene is that we can tell a particular technology what to do, but we cannot replace the emotions of the human being. We cannot replace one-to-one talking. We cannot, only a computer will not give the answer for that. If somebody needs a solace, he needs a solace. Yes. And human voice in itself is the best healer by itself. If you look at the sound, the most inexpensive way is the voice of the person. There are so many times that you want to listen to this voice and not the other one. Why? Because the vibrations are not matching. So our whole system, that is, be it bones, be it muscles, they have their own set of vibrations. And it is like a well-oiled orchestra. And in case if one note is jarring, then in that particular case what happens is the music goes out of sync. And as a result, this is called a diseased thing. So how to get it back? With removing the dissonance and giving back the proper kind of sound therapy, it can help a person. I will never say that this is the only treatment that is there. It can only supplement our medication. But at the same time, it is an inexpensive way of doing it and will help a lot of people.
Thank you, sir, for your valuable thoughts. And on this note, I would like to thank you for this.
Thank you.
It's a real pleasure for me to be here at the Gangaram CME, where the focus is on smart clinics and smart therapies. And I'm so delighted to use in my own practice artificial intelligence, not only to help me to transcribe what I want to say about the patient in the clinic, but additionally to help me to make smart presentations for the several meetings that one attends. Thank you.
Hi, I am Dr. Lalit Duggal. I am a rheumatologist in Gangaram Hospital and attending this annual CME as a faculty. So, my take is that technology is absolutely important and it is a good thing for the future, and one has to be ready in the future as far as this particular field is concerned for a better diagnosis and management of our patients.
Good morning, sir. Sir, as you're taking care of rheumatology, I would just like to ask you, people think rheumatology is only pain. कहीं पे भी पेन होगा तो हमें सर के पास जाना है, rheumatologist के पास जाना है. I just want to understand where all a rheumatologist play a very important role.
Yes, so pain does not only mean rheumatology. Pain can be so many other fields also. Specifically, rheumatologists are required when you have pain, swelling in the joints, young patients coming with pain, low back pain. So that is where a rheumatologist comes in. So it's not only joints. Rheumatology involves other features also. For example, systemic involvement, dry mouth, dry eyes, and breathing difficulty along with joint pain. So it is basically a wide systemic disease, not only involving the joint. One has to be very particular about that. Secondly, specific complaints related to joints, for example, morning stiffness, difficulty in getting up, at night having discomfort, turning in bed. So these are specific rheumatologist complaints, not going to an orthopedic surgeon or anywhere else. So they are the purview or the field of a rheumatologist. So joint pains, presence of other systemic features in the form of maybe dry mouth, dry eyes, presence of lung involvement, kidney involvement, again associated with these complaints would deserve a rheumatologist rather than going to those particular fields upfront. And then the rheumatologist can guide where to go.
So like today's topic is more on technology driven smarter diagnosis and management. I just want to understand how important is technology when it's about rheumatology?
Technology is going to be the future as far as rheumatology is concerned. Why I say that? In advances in rapid diagnosis and specific better diagnosis, even in the field, maybe in the labs, and most important for us in imaging, where it can pick up diseases or pick up the areas very fast. However, the end point is a human brain or a human mind is required, at least in rheumatology, to make a final diagnosis.
So I'll just end this by saying that doctors like you will take the pain away. Thank you so much and have a lovely day.
Thank you.
Hello, I am Dr. Archana Arya and I am a pediatric endocrinologist at Sir Gangaram Hospital. I am here for the 15th annual CME of our hospital, which is focusing on sharper diagnosis and smarter management. In my field, I deal with endocrine or hormonal problems in children, such as growth issues, short stature, etc., pubertal abnormalities, early or delayed puberty, which are a very important part of a child's growth and their development into a normal adult. Along with that, I deal with subjects like differences in sexual differentiation, obesity and diabetes. As we all know, obesity in children has become a major problem in our country as well as the Western world, and it is very important for us to prevent this from happening. Our aim should be to prevent and not to treat obesity, and it will cut down on the future complications like diabetes and cardiovascular disease, etc., especially in our country, which is where the risk of metabolic and cardiovascular abnormalities is far more common than the Western world. So we have to focus on healthy eating for our children, physical activity, to prevent and screen the obese children regularly. So if they have developed any metabolic complications or diabetes, etc., it can be, we can address it, nip it at the bud rather than they're developing problems later on in life.
Hi, I am Dr. Neeraj Jain, consultant rheumatologist at Sir Gangaram Hospital. I am attending SGRS CME, this is 15th CME, and what I feel about AI is that we should be future ready with AI, but AI should not take away our human touch. It should help in our accuracy, efficiency and personalization care of patient, but still I think the human touch remains the core or the central phenomena in all AI based management. Thank you so much.
Hi, my name is Dr. Shrey Jain, and I would like to say that with AI coming, we need to be more accepting, because AI is not here to replace our jobs, but it is here to help us in doing our jobs even better.
Hi, Dr. Shrey.
Hi.
As you're treating patients with Parkinson, I just wanted to understand that as we're talking about AI, technology, smarter diagnosis, how helpful it is in your stream.
So even in Parkinson's, so we do deep brain stimulation, which helps in patients with Parkinson's. So there is newer technology that is coming even in deep brain stimulation, which is called adaptive DBS. What that means is there is AI inside the DBS, so it records the potential of the brain. It tries to assess what kind of symptoms the patient is having, and then it delivers current so that the patient's symptoms, they resolve on its own. So you don't need to go to any doctor, you don't need to program your pacemaker, you just need to sit and the machine is going to do the work for you. So it dramatically helps with the life.
as a lot of people are saying, and there are a lot of debates around the world, that as technology or AI is coming in, there will be eradication of the clinicians. You really believe so?
Well, not really. AI is there to help us. It can make our job easier. So there are two types of people: people who are absolutely against AI, and people who are
Pro AI.
accepting of AI, and they are trying to incorporate that in their life. With time, if you do not accept AI, then your job might get lost, right? But if you accept it, and if you try to incorporate it, it will make your life much easier, and it will help in better diagnosis and treatment of the patient.
So I believe it's an enabler rather than, threat to anybody.
Yes, of course.
So on that note, thank you so much, sir.
Thank you.
Have a lovely day.
You too.
Thank you.
Hi, good morning. This is Dr. Shweta Gogia. I'm a senior consultant at Sir Gangaram Hospital Department of ENT, and I welcome you all to the 15th annual SGRH CME. Here we are promoting sharper diagnosis and smarter management. Improving technology and the latest technological advancements in medicine means sharper diagnosis, better healing, and faster healing for all of us. So technology should be integrated in our medicine field in all possible ways. Thank you so much.
Hi, Dr. Shweta.
Hi, Aarti.
As we're talking at our CME of Sir Gangaram Hospital today, just wanted to understand, as you're an ENT specialist, how technology is enabling your discipline at this point in time, and how future ready we are.
So if I start from where I started, being a medical student in my college, I started seeing ENT as a very, a discipline which did not have any science to it. It was very crude, very native, I would say. But as I've grown into it, I've seen technology making a major role in our realm. We see a lot of, the endovision systems that we are using these days, the 3D systems, the 4K systems that we are using. It makes our surgeries flawless, and it gives us a much better insight into the patient, and we are able to give much better results what we were able to give about maybe 15 years back. There are so many types of lasers that have been incorporated into our field. There are so many types of diagnostic therapeutic procedures. We are doing procedures now for the evaluation of voice disorders, evaluation of dysphagia in patients, and patients which were, just left to heal on their own, or just left there. Now they are being treated in such wonderfully beautiful ways because we know what's happening to them, and we are able to basically guide them through their treatment process. Then coming to technology in ENT, I would say it plays a major role in patients, especially pediatric patients who are born deaf and dumb. So we are now doing cochlear implants for more than 20 years, and cochlear implants have also evolved over this period of time. And now when we see a patient who has been implanted at the age of maybe 2 years, and they come and see us maybe 5 years later, we can't even make out that they were deaf and dumb at that point of time. I mean, they were just normal people behaving normally, using every gadget normally, using their telephones normally, computers normally, and they are now progressing like any one of us. So technology in ENT per se, I would say, what I've seen in my field, it has shown a tremendous increase, and it has given us, a playground, a wide field to play around, and to make our patients much better than what we were doing about 20 years back. So yes, technology is a major thing, and I think we should all be open. We should all be taking these new things with open hands rather than being, just not accepting it. So if we are open to all these new things, we are becoming better doctors, better individuals, and better caregivers every day.
Thank you, ma'am, on this acceptance of technology where a lot of controversies are around the world. I say technology is an enabler in any of our disciplines. Thank you so much. Thank you so much for your thought.
Thank you.
Thank you.
I am Dr. Ajit Sinha, Senior Consultant and Vice Chairman, Department of Neurosurgery, Gangaram Hospital. For me, the technological advancement is of great help in neurosurgery, making it very safe and precise, and that is very much needed nowadays. Gone are the days when people were scared of diagnosing and the outcome of neurosurgery, now it is very, very safe, and thanks to the development of technology.
Good morning, Dr. Ajit. As you are taking care of brain stroke patients or a hemorrhage patient, I would love to understand that how technology is an enabler when it comes to that.
If we see historically, initially there were no CT scan, then the CT scan came, then MRI came. With each development in these technologies, there is perfection in first diagnosing the cause, whether it is hemorrhage or it is just a ischemic stroke, and the reason for hemorrhage. There can be so many reasons for hemorrhages. For example, like by angiography, we know which vessel has ruptured, what is wrong with the vessel, and hence the treatment is accordingly formulated. So if we talk 30 years back, 40 years back, the outcome of brain hemorrhage was very dismal, and in society also it was feeling that brain hemorrhage means everything is gone, but no longer is that true nowadays. Because of the advancement in technology, the diagnosis as well as the treatment, and hence the prognosis outcome has changed dramatically, and it has gone in our favor.
So, as I understand what you're saying, you are pro technology, and do you believe that we should be future ready and accept technology as it is?
Yes, of course, of course. We have to be up to date, and we have to accept the technologies. But once the technology gets approval from the medical science, it has already undergone so much of research and modifications. Then only when it is felt safe, then only it is referred back to the hospitals when they can be using that technology. So once it is approved, we must adopt those technologies. We must take advantage of those technologies.
Thank you, sir, for your advice and your views. I hope with doctors like you, we are much safer. Thank you.
Thank you, my
Good morning. I am Dr. Anil Aggarwal. I am a senior consultant in HPB and liver transplant surgery at Sir Gangaram Hospital. And it's a pleasure to be here at the 15th annual CME of Sir Gangaram Hospital. As we all know, Sir Gangaram Hospital is at the forefront of embracing any advancement in technology for giving the benefit to the patients at large. And I am very proud to be associated with Sir Gangaram Hospital. And in fact, the way the diagnostics have improved, the perioperative care has improved, now the patients can be offered all the advantages, including of minimal access surgery, which is laparoscopic or robotic surgery, to have the best outcome in these patients. So,
sir, thanks for joining us.
Morning, thank you.
I just wanted to ask you, as we were just hearing many discussions which we've been having on the CMA, and if your discipline, how technology has been an enabler, rather than a lot of people don't accept it. But as you just said a minute back when we were discussing that we've been one of the hospitals who have envisaged and looked for future ready technologies always. And they have been a part of us as an innovator. We call ourselves first time innovators also as a hospital. How technology has been innovator or enabler in your stream and discipline?
Like, see, technology has strengthened the clinician in terms of better diagnostics, better perioperative care, because you have the gadgetry to look after the patient in that manner. And, if I was to talk in my specialty or our specialty, the way things have progressed, I think earlier on for certain cancers, digestive surgery cancers, it was thought that it was a death knell for once you are diagnosed with that. But there was so much progress that there were so many long-term survivors in that. And so much so that eventually when the minimal access technology came in, like the laparoscopic and robotic surgery, in fact, the same benefits could be and the same outcomes could be achieved by laparoscopic or robotic surgery. Because in fact, one of our patients, when we embraced this and started doing gallbladder cancer surgery laparoscopically, and let me tell you, at one time gallbladder cancer itself was thought that okay, maybe
threat to life,
will it,
end of life.
So but then with laparoscopic surgery, like one of our initial patients is completing 14 years.
Wow.
And so, which is gallbladder cancer and also in terms of laparoscopic. So I think now with the minimal access approach, the way the technology has advanced, you can do what you could do with open surgery, conventional surgery, and
do the same kind of clearance because everybody talks about oncology, whether are you able to do the same thing? And so that has very emphatically been shown by the world literature that that is possible, and with having in fact added advantages in terms of cosmesis, etc., not cosmesis but early return to work and early institution of any adjuvant therapy like chemotherapy, etc., because with the keyhole surgery the patient recovers faster and is ready to undergo any adjuvant treatment.
So, taking a point from what you said, just want to ask another question.
Right.
There's a lot of myth about technology, robotic surgeries. I just want you to ask that, how safe is robotic surgeries?
See, again, as we say that it depends on the person, these are all tools. So, if the surgeon is competent surgeon to do conventional, laparoscopic or robotic, it's all safe. So, it's how you apply that. Probably the myth that people have is that every case you should do robotic. What is important is that whichever technology suits a particular patient or the procedure, that is what should be adopted. And I think, as you rightly said, the emphasis has to be, your goal has to be clear that what is you're wanting to achieve in terms of the surgery and what is your focus depending on the patient. So I think safety, like whatever can be done safely in a given patient to achieve the same results in terms of the surgical procedure and the post-operative outcome.
So the outcome is that go back to your doctors, take their advice and trust in them.
Right.
Which we always say, trust of generations in Sir Gangaram Hospital.
Right.
Thanks for joining us, sir. Have a lovely day.
Thank you. Thank you.
Thank
Thank
you,
you very
sir.
much for the invitation. It's a pleasure to be here.
Thank you, sir.
I am Dr. Ujjwal Parakh. I am a pulmonologist at Sir Gangaram Hospital, and I am here at the Sir Gangaram Hospital's 15th annual CME. And this is on sharper diagnosis and smarter management. I am a pulmonologist, so what I have seen over the years that the use of technology has definitely helped us in improving the diagnostics and the therapeutic part of the management of patients. With the increased usage of AI and our knowledge of AI, which is very, very essential in today's world and for the future, we need to be updated about the newer AI possibilities and integrate it into our medical practice so that we have a better way of managing the patients and giving them better quality of life. Quicker diagnosis, precise treatment is the actual goal of whatever we are going to do with the AI in medical science. Thank you.
Hi, I am Dr. Abhinav Guliani. I am a consultant pulmonologist at Sir Gangaram Hospital, and I attended the CME today, which enlightened me and gave me the opportunity to interact with a lot of general practitioners, varied doctors with whom we can collaborate and advance in patient care together. The future is with the AI. Why? Because AI is helping us in many aspects of medicine which we could not have imagined. And with the ongoing process of us understanding AI and AI understanding us, it will take some time for us to get there, but I think that is the future.
I am Dr. Alok Aggarwal. I am heading the ENT department, Sir Gangaram Hospital. I am working there since 1994. We have started hyperbaric oxygen therapy in our department to treat the patients of sudden sensory neural hearing loss, जिनकी कान की सुनने की क्षमता अचानक कम हो जाती है. तो उसमें हाइपरबैरिक ऑक्सीजन का रोल है. हाइपरबैरिक ऑक्सीजन का ओनली रोल नहीं है, इट इज एडजुवेंट थेरेपी, एक एडिशनल थेरेपी है. नॉर्मल एंटीवायरल थेरेपी, नॉर्मल स्टेरॉइड थेरेपी, नॉर्मल इंट्रावीनस इंजेक्शन थेरेपी, इन द टिम्पैनिक मेम्ब्रेन थेरेपी के साथ हाइपरबैरिक ऑक्सीजन थेरेपी है जो हम लोग यूज कर रहे हैं. इसका बहुत अच्छा रोल है. मैलिग्नेंट ओटाइटिस एक्सटर्ना, जहाँ पर कि ऑस्टियाइटिस ऑफ स्कल बेस बोन्स होती है, उसमें हमारे डिपार्टमेंट का जहाँ तक सवाल है, नाक कान गले का सवाल है, उसमें बहुत अच्छा रोल है हाइपरबैरिक ऑक्सीजन का. इसके अलावा जितने भी ऑस्टियो रेडियो नेक्रोसिस पेशेंट जिनकी की हेड नेक सर्जरी हुई है या कोई भी सर्जरी हुई है, उनका रेडिएशन हुआ है और रेडिएशन के बाद उनके ऑस्टियोरेडियो नेक्रोसिस हो रही है, उसमें हाइपरबैरिक ऑक्सीजन का बहुत रोल है। डायबिटिक फुट या ऐसे चीज़ें जो कि हील नहीं कर रही हैं, उसमें बहुत अच्छा रोल है। इवन टूथ इम्प्लांट्स जो आज की डेट में करे जा रहे हैं, जिसमें कि कभी कभी साइनस लिफ्ट करा जाता है और बहुत ज़्यादा पेन होता है, उसमें बहुत अच्छा रोल है। तो हमारी हाइपरबैरिक ऑक्सीजन थेरेपी जो गंगाराम हॉस्पिटल में अभी पिछले 8-9 महीने से ही शुरू हुई है, बहुत अच्छा रोल है एज ए एडजुवेंट थेरेपी in treating different type of chronic ailments and some sudden ailments, as I told you, like sudden hearing loss.
मैं डॉक्टर शशिराज झा, चेयरमैन डिपार्टमेंट ऑफ थल्मोलॉजी सर गंगाराम हॉस्पिटल। ये हमारा जो अस्पताल का 15वां CME आज हो रहा है, बहुत ही अच्छी तरह से इसको व्यवस्थित किया गया है और इसमें जो टेक्निकल बैकअप है वो तो समझिए कि मैंने आज तक कहीं और नहीं देखा। और जो इसके जो कंटेंट्स हैं जो जनरल प्रैक्टिसेस के लिए हमारी जो टीम ने बनाई है, तो इससे तो बहुत ही ज़्यादा इनको फ़ायदा होगा और इनके मार्फत से जो आम जनता है उनको बहुत फ़ायदा होने वाला है। तो मैं तो बहुत ही आज प्रसन्न हूँ कि हमारा अस्पताल एक ऐसा कार्यक्रम करता है जिसमें लोगों का भला होता है।
Good afternoon, sir. Good afternoon. Welcome to the 15th annual CME. Sir, as you are the chairperson for ophthalmology, I just want to understand how technology is an enabler today, आपके discipline में, and how it's going to be in the future. What is your thought about it?
See, ophthalmology is all technology, and we have the advantage that our organ is optically accessible. We can see most of the part of the eye. So any new gadget, any new invention always comes to us first. So that is our advantage, and that is one thing. That only problem is that it puts the cost up of the instruments. So we are all technology driven. We are still in the process of evolving, and technology will definitely evolve further and will make life of people more comfortable as far as the eyes are concerned.
So do you think in future, आपने cost की बात करी, तो आपको लगता है कि आगे जाने वाले time में cost भी नीचे आएगी?
Yes, as happened with most of the instruments and even the intraocular lenses, the cost will go down as the production will increase, demand will increase, and even the patent rights of the companies will go. Definitely the cost will come down.
Thank you, sir. Thank you for your thought and joining us. Thank you so much.
Thank you. Hello all. I am Dr. Nitin Gupta, Chairperson and Head, Clinical Hematology and Bone Marrow Transplant, Sir Gangaram Hospital, New Delhi. And I am attending 15th Annual SGRS CME in Indian Habitat Center, New Delhi.
Dr. Nitin, thanks for joining us. So as you're taking care of a lot of chronic patients in hematology, what are the latest things or cut. Pehla cut hai mera din ka aaj. Dr. Nitin, thanks for joining us. As you are a part of hematology team at Sir Gangaram Hospital, can you tell us what is the latest things happening in your discipline?
So, in clinical hematology as a and bone marrow transplant person, we do see patients with complicated anemias, leukemias, we do myelomas, lymphomas, so many malignancy, and do their transplants as well. So hematology and oncology as such is a very rapidly advancing field, and every maybe decades treatment patterns are changing. The latest development I can say in our field is bispecific antibodies therapies, which we known as also BiTE antibodies. So they are kind of changing the treatment patterns in multiple myelomas and lymphomas. So they are very exciting drugs. So what they do, they actually harness the benefit of our immune system T cells, and bring them in close contact with the malignant cancer cell, and the killing is done by the patient's own cells. So these are very exciting development. Another is a CAR T cell therapy, which is a kind of a bispecific antibody therapy only, but the cells are modified to fight patient's own cancer cells. Then there are targeted therapies. Newer targeted agents are being developed, which are changing the treatment paradigm.
say for example chronic myeloid leukemia, chronic lymphocytic leukemia, which were previously treated with chemotherapies and immunotherapies. Now they are just getting one pill and they are living normal lives. So the field is advancing at a very rapid pace, and I think it is good for the patient's overall outcome, and it is improving their survival.
Thank you, sir. Sir, my very next question is, how smarter diagnostics or technology analysis in your field helps?
So again, the diagnostic is actually always running ahead of the treatment modalities. So diagnostic modalities are actually advancing at a very rapid pace. Of course, their treatment will take time to come to their levels. Say for example, next generation sequencing. So next generation sequencing has come a become a integral part of our diagnostic nowadays. Earlier we used to do PCR or fish based analysis in our patients with leukemias. Now everybody is we are going with NGS, which gives a lot of mutations analysis which were previously not detectable by doing the conventional testing. So that gives us more therapeutic targets as well. That improves our prognostication power as well. So in Gangaram Hospital we have next generation sequencing established in a couple of years back. So that is we are using in our patients as well.
Thank you, sir. Thank you so much.
I am Dr. Mukund Khetan. I am a co-chairperson in the Institute of Minimal Access Metabolic and Bariatric Surgery at Sir Gangaram Hospital, New Delhi.
Dr. Khetan, as you are specializing in hernia,
yeah.
There was a time when people used to think that hernia cannot be diagnosed right, or we have no life left, or it cannot be medically treated well. So where are we today, and what all is happening in your field?
Yeah, so when in our medical school time, when we started our training in the surgical field, especially in the hernia part, so we were all seeing the difficult times, like the patients are not ready to accept that they are suffering from the hernias, and it's an open era of surgery. So they are always afraid of whether after getting a surgery done, whether they are going to get back to their normal work also. But then since the inception of laparoscopic, which was introduced in 1992, and we are for...
So since inception.
Yes, as we were discussing that since inception of the laparoscopy, that is way back in 1992, then is the era when the patient used to come us, they are getting more confidence in getting their hernia diagnosed and treated laparoscopically. And we are pioneer, definitely we started the laparoscopic repair of the hernias in 1992. But in last a decade, there is another shift in the hernia management, not only in terms of diagnosis, but also the management. Why? Because we are seeing a large complex hernias, recurrent hernias, the hernias which are being repaired twice or thrice, and then they are coming with a large loss of domain hernias, where most of the abdominal contents are hanging out of the abdominal walls. So then the introduction of the abdominal wall reconstruction started, and that has changed the scenario of management and diagnosis of these difficult, or I'll say, end stage hernias.
So another question branching from here is that technology is taking over a lot of things, and robotics is already available in Gangaram. So what do you have to say about that?
So in technology, as I said, that there are two parts to the technology. One is your technical considerations are being changed. That, as I said, that from the laparoscopic repair, now we are doing an abdominal hernia reconstruction or abdominal wall reconstruction. The other part is the availability of the technical tools. So we were doing it laparoscopically initially. Now since last more than a decade, we are doing it robotically also, especially in the difficult areas. So robot is a one platform where the difficult areas can be handled in a better way because of the reach of the robotic instruments in that area, because it takes away the tremors from the surgeons. It have more movements, 7 degrees of movements of the instruments. So those robotic technology, though it is not used in all cases, but definitely in complex hernias and difficult hernias, in a large recurrent hiatal hernias, the hernias which are associated with the gastroesophageal reflux disease. So those can better manage with the robotic platform.
So I'll end by saying that at Sir Gangaram Hospital, we are technology driven at the right time and the right place. Thank you, sir.
Thank you.
Hello, I'm Dr. Tinku Razdan. I'm a senior retina specialist and a cataract specialist at the Department of Ophthalmology at Sir Gangaram Hospital, Delhi.
Good afternoon, ma'am.
Hello.
As you're dealing with a lot of cataract surgeries, I would just like to understand for today's audience or whomsoever looks at it, the youngsters, that how cataract surgeries have improved over the years and where are we today when it comes to technology?
So, cataract surgery has evolved tremendously over the years. So, we started off with intracapsular cataract surgery, where the surgery was done through a very large incision, then extracapsular surgery, where again the incision was around 5 millimeter and the entire cataractus lens was taken out and the wound had to be sutured. But today we are in the era of micro incision cataract surgery. So we enter through an instrument, through an incision which is only around 1.8 to 2 millimeters. And we go in, do the entire surgery, remove the lens and come out, and this wound seals itself. So the patient is rehabilitated very quickly, surgery has become very quick, and it's become a daycare surgery. The patient walks in and then walks out of surgery. It takes only 15 minutes to do a cataract surgery. We don't put any bandage on the eye, it's a topical surgery now, so we just use topical drops to anesthetize the eye. And the surgery is done in 15 minutes. There's no bandage. There is no restriction on any activity after surgery. It's just that the patient is asked not to rub his eyes, but every other activity he can do. And also, if I talk about the lenses, there's been a tremendous improvement in the lenses that we now offer to patients. So cataract surgery, apart from offering better vision to the patient, we can also help the patient to get rid of their glasses. So if a patient was earlier wearing a high number, we can put that number into the lens that we are implanting into the eye. So patients can now be glass free, that is complete independence from spectacles. Yeah, in fact, we have lenses now which can also correct for near vision. They are called EDOF lenses, that is extended depth of focus lenses. So the patient who was wearing glasses for reading before can now get these new generation EDOF lenses and then be spectacle free both for distance and for near. So no spectacles whatsoever.
Well, that's wonderful.
Yeah.
It will be very educative for the people who look at this and who would love to know about cataract surgeries. Another questions from there. As technology is driving everything today, whenever we look around, I think today's CME is also all about smarter diagnostics, smarter management. How do you think it's impact
technology driven? Yeah, so right from our diagnostics, where we have instruments like the optical coherence tomography, which maps out your retina. So the back part of the eye where the image is formed, that has to be perfect for all these new generation lenses to work. So we can get a complete map of the inside of the eye. It just takes a minute or so, and you get complete information of what is going on inside the eye. So that is OCT, which is really, kind of revolutionized our diagnostics. And of course, if you go into instrumentation, then, lot of new machines to do cataract surgery, which are faster, which cause no pain to the patient. The healing of the wound is quicker because of these machines. They're very atraumatic. And like I said, technology is there in the new generation lenses also.
So I'll end by saying that at Sir Gangaram Hospital, we are at the top-notch technology which we use, and we have best of doctors to take care of. Thank you, ma'am, for joining us.
Thank you. It's a pleasure.
Thank you.
Want to talk about the CME?
One line if you can, separately. Just talk, you can start from a CME, please.
So it's such a pleasure to attend the CME. I can see a lot of old familiar faces. This is the 15th year of the CME that we've been organizing. We started off way back 15 years ago, and over the... So it's such a pleasure to attend the 15th annual Sir Gangaram Hospital CME. I've been a part of the organizing committee, and over the years we've seen the CME go from strength to strength. So every year we see so many familiar faces who are there with us year after year, and an influx of new people also. So apart from the updates in all these specialities, what drives the CME is the new bonds of friendship that people form with each other. So I see a lot of interaction, lot of questioning, lot of interest, and that is the raison d'etre of this CME. So welcome everyone, and I hope you have a great time.
Sir, as you are attending the 15th CME for Sir Gangaram Hospital, I would just love to know that what is your vision for next generation technology and how the artificial intelligence is going to be embedding in the medical scenario.
Well, this is the 15th CME, and we had started from a very, very basic fundamental medical topics and gradually have progressed. And this time the topic chosen is a very topical topic, which is the increased use of technology and high tech in medical healthcare. Gangaram Hospital, as you know, always tries to keep abreast with all technological advancements. And so, hence this CME, by which we would like to share with our colleagues all around us who are practicing what are the technology advancements that we have made, which the world has made, which we have adopted. Now, coming specifically to your question, as far as technology is concerned, we are heavily into robotic surgery, we are into lasers, we are into high-grade radiotherapy equipment which are precise, which will take care of the cancer very, very minutely. We are into organ transplantation, including bone marrow transplant, liver transplant, kidney transplant, etc. Finally, artificial intelligence. Well, there is a lot of talk of artificial intelligence. Let me tell you that we have to progress very carefully in this direction, because even today it is not a very recognized or controlled intelligence. So any uncontrolled intelligence can prove to be either way. However, having said that, from what we hear and what we read, artificial intelligence is going to make a big, big impact on healthcare and the way we deliver healthcare. And personally, I feel that we will start with back office, which means that patient appointment systems, EMRs, and then diagnostics, radiology, CT scan, MRI reporting will be gradually taken over by AI. Taken over does not mean that the radiologist or the reporting doctors will become superfluous. However, AI has such a wide capacity of assimilating knowledges and all that, that they can do analysis of very huge quantity of data, and that is going to be very helpful in detecting, especially in oncology, in breast cancer detection. Early detection will be a big thing, next big thing using AI. And I can assure you that Gangaram Hospital is definitely very seriously considering AI and its contribution, and we propose to have a independent department of AI in healthcare in the very near future. And next time when we meet, I'm sure I'll be able to tell you much more about AI in healthcare.
So branching another question from here, can you also tell me your thought on, do you really believe that any technology can eradicate personal touch of a consultant or patient?
Now that is a very touching question.
Yeah, exactly.
That's a very touching question. There is no question of this profession is totally different from many other professions. And no amount of technology, nothing can replace the doctor. The doctor or the nurse, why I don't limit myself to the doctor, the nurse, the technician, nothing can replace it. You may, package it much better, it may become finer, that's point well taken, but ultimately it is the doctor which has to give a touch to the patient or to the relative or to the parent of a grieving patient, and that cannot be replaced by any intelligence. It has to be basic fundamental ethics and nothing else.
Thank you so well put. Dr. Manchanda, as you're also on the podium, just one question from you.
Sure.
As medical education is evolving rapidly, what role does CME like this play in keeping clinicians future ready?
I think it's a very, very important issue because the thing is, a lot of people do not get the chance to go as far in learning into the newer sciences. And the pace at which things are occurring, even we are learning all the time. The thing is that it is a kind of a balance that we have to create in the society so that our fellow colleagues, and we can basically learn from each other. It is not just one way. The thing is, but the newer block, the newer kind of devices, the newer kind of systems which are today prevalent, and we have got such wonderful kind of our chairpersons and who have always supported this kind of an event. In the last 17 years, this is the 15th one, barring 2 which had been gone for the COVID. But the thing is, yes, every year we talk to our fellow practitioners so that we can take them up to the level where we are doing the newer things and what they can contribute and how we can learn from each other.
Thank you, sir, for joining us. That was lovely.
Hello friends, I welcome you all to 15th Sir Gangaram Hospital CME. It's a very exciting day for all of us here at Gangaram Hospital, where who's and who of Gangaram Hospital are showcasing the best of best work that they have done in the past few years and highlighting how modern technology, artificial intelligence, science and the new research are all coming together to improve the quality of life of our patients, whom we really wish to serve the best possible way we can. I am Dr. Manas Kalra. I am a pediatric hematologist, oncologist, immunologist and a bone marrow transplant physician. And I look after children who have got these very difficult, very complicated disorders. And when science, research, technology, the hospitals will all come together, it all reflects into the better outcome of our patients. Thank you.
डॉक्टर मानस, आप बहुत सारे बच्चों को ट्रीट करते हैं जो कि कैंसर से सफ़र कर रहे हैं या ब्लड कैंसर होता है. कैन यू टेल मी आजकल कौन से सबसे ज़्यादा एडवांसेस हैं जो इस लाइन में हुए हैं, जो लोगों को पता होना चाहिए कि इट इज़ वेरी मच ट्रीटेबल, देयर इज़ अ टाइम व्हेन यू नीड टू गो टू अ डॉक्टर एंड दे कैन टेक केयर ऑफ योर किड्स. तो आप उसके ऊपर थोड़ा सा मुझे बताएंगे.
So it's a very important question, Aarti ji, because you see कैंसर नाम सुनते ही इंसान डर जाता है, कांप जाता है. उसने कभी सुना ही नहीं है कैंसर वर्ड, और किसी के बच्चे को कैंसर है, यू कैन ओनली इमेजिन व्हाट्स गोइंग थ्रू देयर माइंड. यू नो, एज डॉक्टर्स वी आर सीइंग कैंसर एवरी डे, बट फॉर देम दिस इज एन अर्थ शैटरिंग word that, and for the most precious thing in their life. So cancer word itself लोगों को बहुत ही डरा देता है. And I want to really tell that why this has happened. This has happened because हम movies में ये दिखाते हैं कि हमें किसी character को finish करना है तो उसको cancer हो गया. That's not the reality. Children with cancer can be cured. And this is very important. We don't win all battles, but we win most of them. So chemotherapy is the big thing that we use to treat children with cancer. Blood cancer, जिसका आपने नाम लिया, बच्चों में होने वाला सबसे common cancer है, और हम पिछले 50-60 years से chemotherapy का इस्तेमाल करके बच्चों के कैंसर को क्योर करते जा रहे हैं. But success rate एक लेवल पे आके रुक गया, और हमें लगा कि क्या अब हम इसमें progress नहीं कर पाएंगे, क्या कैंसर का इलाज और आगे नहीं बढ़ेगा, क्या हम 60-70% पे आके रुक जाएंगे. But then thanks to technology, thanks to innovative medicine, now we are using many newer forms of therapy. इसमें targeted therapy का इस्तेमाल हो रहा है. कुछ तरीके के कैंसर हैं जिसमें, जैसे कि CML, उसमें हम सिर्फ एक टैबलेट का इस्तेमाल करते हैं. It's not chemotherapy, it's a tablet and you just take a tablet and your cancer is kind of controlled. Then we have immunotherapy. इम्यूनोथेरेपी में हम क्या करते हैं कि आपकी बॉडी के अपने इम्यून सिस्टम को जो कैंसर को कंट्रोल नहीं कर पाया उसको सशक्त बनाते हैं कि वो आपके कैंसर को ही मार सके. सो यू नो यू आर स्ट्रेंथनिंग योर ओन इम्यून सिस्टम टू किल कैंसर. दैट्स इम्यूनोथेरेपी. देन वी हैव कार टी सेल्स, जहां टेक्नोलॉजी ने बड़ा एक मिरेकल किया कि आपके बॉडी के टी सेल्स को निकाला जो अच्छे सेल्स हैं, उसमें कुछ टेक्नोलॉजिकली उन्हें मॉडिफाई किया और फिर वो आपके बॉडी में वापस डालेंगे ताकि वो आपके गंदे बी सेल्स को, कैंसर वाले बी सेल्स को मार सके. So we have done a CAR T cell for a child, and you know, touch wood, he's doing well, and he had a cancer which had come back twice. So it's a big achievement for us. And then there are bone marrow transplants. अब bone marrow transplant में ट्रेडिशनली क्या था कि अगर भाई बहन मैच हो तो उसी से ट्रांसप्लांट करते थे. बट नाउ वी आर डूइंग लॉट्स एंड लॉट्स ऑफ हैप्लो ट्रांसप्लांट, हाफ मैच ट्रांसप्लांट. सो अगर आपको फैमिली में डोनर नहीं भी मिल रहा मैच, फुली मैच, तो आप हाफ मैच डोनर से भी ट्रांसप्लांट कर सके. तो these are the new innovations that have happened in the field of blood cancer and cancer in general, which has led to better outcomes.
Sir, I'm branching a question from here only now.
Sure.
Do you really think, and as a doctor, can you tell us that if a patient is cured by cancer, which is a child patient, वो अपनी जिंदगी नॉर्मल जी सकता है बाद में?
So very important question, and you know, I think every parent wants to know कि मैंने मेहनत कर ली, मैंने अपने बच्चे को बहुत मुश्किल समय में से गुजारा, उसने बहुत तकलीफें झेली, क्या वो एक अच्छी जिंदगी जी पाएगा? So the short answer is yes. So most of the patients who are cured of cancer live a near normal life, which is very good. Now there can be some late effects which we have to monitor. You know, हमें उनके हार्ट का चेकअप रखना है, हमें बीपी चेकअप रखना है, शुगर का ध्यान रखना है, हियरिंग का ध्यान रखना है, डिपेंडिंग ऑन किस तरीके का हमने इलाज इस्तेमाल किया है. सो जो भी हम दवाइयाँ यूज करते हैं उनके कुछ पोटेंशियल लेट इफेक्ट्स हैं, साइड इफेक्ट्स हैं. तो अगर हम उन पे एक बहुत ही केयरफुल मॉनिटरिंग रखें तो हम उन साइड इफेक्ट्स को अर्ली पकड़ पाएंगे और उसका जल्दी इलाज कर पाएंगे और उन पेशेंट्स को बेटर रिहैबिलिटेट कर पाएंगे. सो आई वुड से मोस्ट ऑफ द चिल्ड्रन हु आर क्योर्ड ऑफ देयर कैंसर लिव अ वेरी गुड लाइफ. इट्स जस्ट दैट वी हैव टू बी वेरी वॉचफुल, वी हैव टू बी केयरफुल, वी हैव टू कीप देम ऑन अ लॉन्ग टर्म सर्वेलेंस. पेशेंट 5-6 साल के बाद डॉक्टर के पास फिर नहीं आना चाहता, हम उन्हें समझाते हैं कि नहीं, तुम्हें हमारे पास आना है, साल में एक बार मिलना है, और फॉर अ गुड हेल्थ चेकअप which every human being should undergo once a year.
Last question. How technology is driving medicine or diagnostics today, and how important it is?
So there's a big boom of technology, and I'm really grateful for the scientists who are working to improve healthcare related technology. It has changed our lives. It has changed the lives of the patients. You know, there were so many genetic disorders जहाँ हमें आंसर नहीं मिलता था. Now we do sequencing testing, we do so many new modern testing, and we are able to diagnose. So you know how important it is for a family to get closure, to know what their child is suffering. Can you just imagine a baby has a genetic disorder, कोई blood से related problem, cancer related, जिसका हम कारण ही नहीं ढूंढ पा रहे, and they have to live with that for the rest of their life. Now we are able to find answer for most of them, which is really good. We are still not there for 100%, but I'm sure we will get there. And then coming to therapeutics, जैसे मैंने highlight किया कि blood cancer में इतनी सारे नए हम तरीके की दवाइयाँ यूज कर पा रहे हैं, वो कैसा हो रहा है? वो इसीलिए हो रहा है क्योंकि scientists research labs में बैठ के with the help of technology, with the help of AI, with the help of modern methods of treatment, they are able to find newer therapies, directed therapies. वो एक बीमारी पकड़ते हैं, उसका genetic cause पकड़ते हैं, उसके खिलाफ क्या ट्रीटमेंट इस्तेमाल किया जाए. रीपर्पसिंग ऑफ ड्रग्स, जो पुरानी ड्रग्स जिनको हम भूल चुके थे उनको नए तरीके से इस्तेमाल करने के लिए रिसर्च चल रही. सो आई थिंक टेक्नोलॉजी रिसर्च is a part of modern medicine, and we can't live without that.
Thank you for this, sir. And I think at Sir Gangaram Hospital, doctors like you are the pillars who will not only help patients but also imbibe all these new technologies for the welfare of them. Thank you, sir.
Thank you so much. Thank you.
So, hi. Good afternoon, everyone. I'm Dr. Huma Ali from Sir Ganga Ram Hospital, working as Associate Consultant in Department of Obs and Gynae. So I'm here today to attend the SGRH 15th Annual CME, Sharper Diagnostics, Smarter Management. It's a very well organized program. We are having a great time over here. We are getting to see recent advances and developments in all the other branches, all across the specialty, what is happening new, gathering information in all aspects. It's a very good opportunity for all of us attending over here, presenting here, the discussion, the interaction. The audience are so keen to learn everything they are coming across. So it's a very well organized CME and a great experience to be a part of it.
I am Dr. Tarun Kumar, Associate Consultant, Department of Nephrology, Sir Ganga Ram Hospital. I am here today to attend 15th Annual CME, Sharper Diagnosis, Smarter Management from Sir Ganga Ram Hospital. So far, I have attended all the lectures and they have been so good, so well put and have been discussed thoroughly. And I have discussed my topic too, that was delaying the progression of diabetic CKD, and it has an active participation from the audience. Plus the topics I have observed that the topics which have been put up for the CME have been up to date. There are a lot of new things which are coming up in different branches and which may be so much benefit to the physicians and patients to both, and they have been thoroughly discussed here. Thank you.
Dr. Tarun, as you're taking care of, you are a part of nephrology, and day in and day out you're meeting a lot of chronic patients, transplant patients and patients which has multiple problems. Today at this time when technology is developing at a very rapid pace, cut karo, बीच में मैंने 2 बार halt लिया ना. Dr. Tarun, as you're a part of nephrology team at Sir Ganga Ram Hospital, I just want to ask you that every day you are meeting a lot of patients, which is a chronic patients, which is multiple disorders or a kidney transplant patient, and there are patients which just leaves their hope and say, nothing can happen. In today's time and era, where are we, how much have we advanced in terms of treating patients like that, and how technology is driving your diagnostics at this point in time, and what's the future you think?
So right now we are sitting here talking about the technology and its impact on the life of the patient having CKD. Initially, about a decade back, when we used to talk about the patient, we used to counsel patient. Usually we used to say that the disease is progressing at a very fast rate, at a rapid rate. We can have some medications which can slow down the progression, but we cannot halt it. But in today's era, the diagnostic plus management interventions have advanced a lot, and the technology has helped a lot in that. So starting right from the renal biopsy that we used to do, the instrument we used to do, even in such cases where the biopsy is very difficult, now we are using the advancing technology, like in case of the CT guided, and we have other facilities by which we can even do the difficult biopsy to make the diagnosis. Plus, coming on to the diagnostic purpose, we have introduced the genetic facilities. Initially, the patient used to come at a younger age having CKD, and we usually used to label that it could have a chronic glomerulonephritis or chronic interstitial nephritis because there is no much history associated with it, and we used to label him that. But today, if the patient is coming to us with a significant family history, we are seeing that it is a syndromic association. Many systems are getting involved together. We are getting some clue. So today we are ordering the next generation sequencing. These are the genetic techniques to identify what could be the disease and what could be the effect of the disease on the further life of the patient. So there are some genetic diseases now available to which we can treat with the medications. Even post-transplant, if we are subjecting the patient to a renal transplant, there are high chances of the reoccurrence. So these genetic technology help us to diagnose those patients, to help them before and post-transplant. Now coming to the dialysis technology, initially we used to have hemodialysis, then came the slow low efficiency dialysis, then now we have the CRRT, which is the advanced version of it, that is a continuous renal replacement therapy. We are the biggest center right now doing CRRT. So it helps us to manage the patient who are hemodynamically unstable, who are very prone to shock. So it helps a lot in the management of the patient. Then talking about the further progress, now we are looking at the stem cell therapy, even for the patient who are having kidney disease. In diabetic kidney disease, there already trials are going on. We are trying with the stem cell therapy, injecting them with the stem cell to again reproduce the growth of the kidney, which is usually not possible with any of the medications. Then we are now also looking at a new era where artificial wearable kidneys are being available.
Okay.
So they are being tested in USA. The trials are already going on, not yet approved by FDA. They are still under trial. Then the new thing which is coming up is the xenotransplantation.
Yes.
Even from the animals, usually these are genetically modified animals like pigs, because they have very much genetic composition similar to the human beings. By making few changes in their genetic genes, even now coming up with xenotransplantation, in which the genetically modified animals like pigs, they are being used as a kidney donor. So these studies all are going in. Research is being done for the same, and they are all in progress. But we have already made a huge progress in terms of diagnostic techniques. We have now point of care testing for checking the creatinine at a spot only, so we can identify the patient who are at risk. Then in the management protocols, we are getting the new medications day by day. Initially, for the progression of the disease, we used to have only RAS inhibitors or SGLT2 inhibitors, but now we are dealing with non-steroidal MRAs, GLP-1 analogs, dual positive incretin analogs. So now coming to the xenotransplantation, in which we are using the genetically modified animals. Those animals which have been genetically modified are being used as a kidney donor. So we are giving a chance to them. Sorry, इसको कट कर, इतनी बारी बीच में ना, नहीं इसको काट दो, मैं दोबारा से करता हूँ, ज़्यादा स्ट्रेस नहीं दूंगा. Now coming to the xenotransplantation, in which genetically modified animals like pigs who have kind of genetic similarity to the human beings are being used as kidney donor. So all these studies are going and they are in progress. So far, starting right from the diagnostic techniques to management to making the lives better of the patient, we have come a long distance. So now we have the techniques available for the spot creatinine testing to identify the patients who are at higher risk. Then for the management of the patient, we have new medications coming up, like along with RAS inhibitors and SGLT2 inhibitor, the non-steroidal MRAs, the GLP-1 analogs, the dual incretin analogs, which are being used even in non-CKD patients, non-diabetic patients, to slow down the progression. Then the new techniques for the dialysis we are getting, the new techniques that we are getting for making the AV fistulas like ellipsis and everything. Then the new techniques which are coming up for the management of the patient who require the renal transplantation, involving these xenotransplantation, the artificial wearable kidney. And so in this way I can say that we have made a huge progress so far, and still there is a long way to go. Thank you.
Hello, I am Dr. Siddhartha CR. I am very happy to be part of SGRH 15 CME, planned on smarter diagnosis and smarter management. The CME is very well organized and on non-contemporary topics involving both technology and healthcare management. Thank you.
A very good afternoon to all. I am Dr. Nipun Rana, consultant in the Department of Joint Replacement at Sir Gangaram Hospital. We welcome you all to the annual CME of Gangaram Hospital. This year the theme is about smarter diagnostics and role of AI and robotics in the entire medicine. And we are happy to have you all here, and it's a wonderful day, and the entire program is being run very smoothly and informative. The knowledge being imparted is being enjoyed by everyone. The kind of panels we have are really good. They are all helping each one of the delegates. And I see a lot of people who are actually participating in the conference, and they are bringing up all fiery questions as well.
So, Dr. Nipun, as you're a part of joint replacement, and this is a very common disease which people come up with, can you just enlighten us with the knowledge that what exactly it is, and what are the advancements in joint replacement at this point in time in Sir Gangaram?
So see, joint problems can happen in any age. Definitely what we are talking about with respect to joint replacement, we are talking of people who have frank arthritis. Arthritis means the cartilage, the soft layer over the bones in a joint, the bearing surfaces has worn off because of various reasons. It can be trauma, it can be age, it can be degeneration happening with age. So such an arthritis which has happened, which has gone to a limit where the bone and bone are rubbing together, the cartilage has totally gone off, we require a surgery called as joint replacement. So the second part of your question, that what are the recent advances or the advances which are happening since the last few decades, is that there are replacement techniques which have gone beyond the prior technologies and the techniques. And the whole idea behind a joint replacement is to change the surface of that area of the worn out surface. So whether the compartment of which compartment of that particular joint is involved, we can change only that particular compartment as well, which is called as a unicondylar knee replacement as well. There are advancements where we can only replace part of the cartilage of the small bone called patella as well, as in isolation, without even changing the entire joint. So, but when the condition, most of the time in our country, the patient is present late and the cartilage has worn out in all the three compartments, we require a total knee replacement for those surgeries. And even there are now techniques which have been developed, which wherein we can do surgeries in a very minimally invasive fashion by minimal releases, by changing the alignment patterns of the knee and producing and bringing about knee replacement in a more less invasive fashion. The new thing which further enhances the minimally invasive nature of the surgery is robotics. So this brings about more accurate and precision technique of bringing about alignment as well as the balance of the knee joint in a more numerical fashion. We have numbers and scoring system in front of us wherein we can see whether we are achieving the goal we want to or not. And that is the whole advantage of robotics, being more minimally invasive, producing less pain, and a good rehab for the patient in the post-surgery period. So these things, there's some of the robotics, and there are. It's not just about the knees. There are other joints like hip joint and shoulder, elbow, wrist joint. They are also the part of joint replacement surgery as well when they do get arthritic. But most commonly in our country, we do see knee replacements and hip replacements because they are the weight-bearing joints, and commonly these joints are affected.
Sure. Last question, that in this era where technology is taking over a lot of things and AI is coming, robotics, as you said, is already a part of your department, you really think that the technology is an enabler rather than replacing anybody? Because that's a burning question we have always. I know. So what is your thought on it?
So see, definitely robotics is an enabler, but another adjective to it is it's an enhancer as well. It not only enables a person to do surgery, which we were able to do before robotics as well, but it enhances our skill. It makes you a better carpenter, you can say, a better artist, you can say, and helps us do the surgery in a more accurate and precise fashion. And so the idea behind producing good results is to produce consistent, reproducible results, to have a monotonous way of working in the same case by producing little tweaks in each and every case, because all bones on the patients are going to be different in their habitus and the timing of surgery we are doing them. But definitely it helps us having a good cross check on how the surgery is going on and how we can actually bring about better changes during the surgery even without executing the final surgical plan. So definitely it is a good enabler and an enhancer, and it removes away all the subjectivity to the surgery, and it gives us more objective data which we can by which we can enhance the surgical results.
So I think I'll just close this here by saying that Sir Gangaram is already on a top notch when it comes to technology, best of consultants, and we are all ready to serve the patients with their ease. Thank you, sir.
Thank you. Thank you so much.
Thank you.
Good question regarding the CME and how it has started, where we have reached. So about 15 years ago, I was the founder chairman of the CME for the first 3 years, after which Dr. Harbans took over and now Dr. Manchanda has taken over. The object of this was to reach out to the general practitioners and give information which is of relevance to them. Not necessarily to give high-tech information to everybody, which are super specialist work, but to give information and advice कि हमारे पास में हॉस्पिटल में क्या क्या फैसिलिटीज़ हैं जो आप अवेल कर सकते हैं, और अगर कोई दिक्कत है तो हमें बताइए. So it was a two-way. Plus information को थोड़ा disseminate करना था. तो 15 साल पहले when we started this, it was more general topics. It was topics which concerned the doctors at the periphery. And if they required information, they could get in touch with us with helplines. Over the years, new technologies have come in. People want to know more. A lot of information is now being given, which is being well received by the GPs. But at the same time, too much of information given at the same time becomes difficult for people to absorb. However, the GPs have received this very well. The numbers have gone up. Today, I think we've got a record number of people coming in for this CME. Very well organized. Virtually all consultants in Gangaram Hospital and the staff are involved in running it. So I think it's a very, very good thing. We have to keep reinventing every time as we go along. So I think as of today, very good. New technologies, new diagnostics, new treatment facilities, all of them, the patient should be aware, the GP should be aware. And they should also be made aware of the costing. That is not to be spoken on the podium, but at least they should be aware what it costs, what is the human factors involved. So I think all in all, the CME has fulfilled its requirement and is going from strength to strength.
Sir, as you've been a part of Sir Gangaram for a long time and you've been treating patients who are very chronic and you've been a surgeon for a long, long time, can you help me understand that how technology has been part of your diagnostic or at the back of your diagnosis, technology has helped you, and what is the future of it?
Okay, it's a good question because I started doing surgery in 1972.
Very well.
So it's almost 53 years I've been a surgeon. And at that time, all surgery was by clinical experience and the equipment was basic instrumentation, basic x-rays, some blood samples, etc. Over the years, we got endoscopy coming in, then we got laparoscopy coming in, now we've got robotics. Diagnostically, we've got so many other examples, we've got ultrasounds, we've got CT scans, we've got MRIs, you've got distance learning, intervention from distance. So all of these go towards improving the diagnosis, improving the overall care. The only problem with all this is that they dehumanizes the patient. You're looking at the reports and not at the patient. And I think that clinical communication, confidence building is where we are losing. And that ultimately will not work too well because unless you look at a patient, touch a patient, hear a patient, right? You lose a lot of things. The machines can only tell you so much. They are images. But future, yes. Robotic, for example, telerobotics. Somebody is operating from a different city for teaching, for mentoring. If somebody is operating and you are sitting in the other place and from there you say, touch that, remove that. So this is all to be done. I think there is no end to what can happen while keeping safety and ethics and confidentiality in perspective. So yes, surgery is going on to better and better things, aided by a lot of the artificial intelligence, which is based on vast data. Not always useful, but yes. So I think the senior doctors have to keep their feet firmly on the ground and not get carried away. But yes, it's very much a futuristic thing, and I think overall care of the patients has gone up. The very fact that patients' life expectancy has almost doubled in the past 20-30 years. People who would not survive beyond 45-50 are now living to 70-80. So that means we are doing something right.
So I'll take it from here that to be patient-centric is very important. While we have a backup from technology, humanization is very important, wherein we are utilizing or enhancing our diagnosis with the technology. Technology is important, but they cannot replace clinicians.
Absolutely. Technology should be a servant, not your master.
Sure, sir. On this note, I'll end this conversation.
Thank you very much.
Thank you so much, sir.
Good evening, everyone. I am Dr. Ushast Dheer. I am the Director of Liver Transplant at Sir Gangaram Hospital. We are celebrating the 15th annual CME today, and it has been an academic feast. And this year the CME is focused on technology and artificial intelligence. We regularly are incorporating technology in our field, and in the field of hepatobiliary surgery and liver transplantation, we are incorporating highest level of technology at Sir Gangaram Hospital, whether it's in the operating room or whether it is before we take the patient for surgery. We have state-of-art operating rooms with the best in the industry 3D and ICD guided laparoscopic equipment to do this surgery laparoscopically, as well as our preoperative evaluation, whether it's softwares, so that we can get accurate and most precise information about the anatomy, about the vascular structures of liver, which we are going to operate in these patients. Thank you.
Hello, I am Dr. Sujay Shad. I am the Senior Consultant Cardiac Surgeon at Gangaram Hospital and also the Director of Cardiac Transplantation at the same hospital. I have been around in the hospital for over 20 years, and I have been doing a lot of other work in addition to coronary surgery and valve surgery and HOCM surgery and aorta surgery. I also do heart transplants, and I have been attending the 15th CME of Sir Gangaram Hospital, and it has been a feast of technology being discussed, a feast of discussions with the general practitioners about what should be the state-of-the-art practices to be practiced in the modern day.
Good afternoon, sir. Sir, you've been around for a long time and you've been a surgeon. I just want to ask you a question that when chronic patients come to you and you are doing a diagnosis, as in the world of technology today, how smarter diagnostics help you?
You see, we now not only have smarter diagnostics, we also have systems to analyze whether a particular patient will require a particular therapy or not. And therefore, the smarter diagnostics, alongside the knowledge that we have already gained over the last 20 years, that helps us to make valid judgments as to what is the appropriate treatment for an appropriate patient and where we might find pitfalls and how to avoid them. We can plan that already before going to the operating room.
Sure, sir. Thank you, sir.
Thank you.
Hello to all. Today we have organized 5th annual Gangaram prestigious CME, and the theme is
Wait, it was 15th, sir.
15th, na?
I heard 5th.
50. Hello to all. Today we are celebrating and we have organized 15th Gangaram's annual CME, which is a very prestigious moment for us. Theme is technology, artificial intelligence, and Gangaram being the peak, that we, in every field of Gangaram, we are using latest technologies, latest advancements. I am Dr. Bheem Nanda, Senior Consultant Plastic Surgeon and Vice Chairman of Department. So in Gangaram or in plastic surgery, the technology is really, we require latest advanced technologies to treat the patient.
Good afternoon, sir. So as you've been a surgeon and you typically work around patients whose image is not in a very great shape, or they're accidental, or there can be a burnt patient where surgeries are very important and where they also look forward to you to give them the image which is closer to them. So how technology has been a part of your discipline and stream while you're taking care of these kind of chronic patients?
So like sometimes, like being a plastic surgeon or a reconstructive surgeon, at the same time being an aesthetic surgeon, people come to us with sometimes a very bad shape, like a severe road traffic accident, patient has severe injury, his face got smashed, or he lost something, he had a very bad wound, or it's a part of a cancer, that part of the face or any part of the body has been removed.
Damaged.
So they want those things to be reconstructed as close to as they used to look before, or as normal as before. So yeah, technology is a very big advancement in those things. We get them investigated. We need a very state-of-art CT scans, MRIs. Then those are fed into a program where a 3D model can be generated. Even nowadays, we have facility of patient-specific implants. Like say if somebody has a damage to right side of face, from the left side of face template, a technology or a software can make a right side of face again, and a patient specific implant can be made, and then we can show the patient that how he is going to look once we use that implant. So we can reach up to a very normal level. We don't promise the results because the AI and technology, and there's a difference between human tissue, how they will behave after surgery. But yes, we can reach up to a very close.
So it won't be wrong if I say that technology was always there.
Yeah.
It was always a part of the medical fraternity. But recently, because of AI, robotics, or I can say the aspect of media, which has been hyped more and the noise is more, that's how also the advancement of technology, which keeps happening day after day, it has been more prominent in the area of medical fraternity now. There's always a news when people say technology can take over the humanization of a consultant, where robotics or AI will take over, the machinery will take over. What is your view, sir, on that?
See, like as I told you, I was just told you, because what is the software doing? They are just moving on a calculation. They have permutation combination, so many permutation combination they can come to reach to. But how does the human tissue behave? How does after a surgery human tissue will behave? Where the vascularity of the tissue, blood supply over tissue, that a computer or a AI cannot judge. So it's like a clinical experience and the anatomy, and we know clinically after when we are doing a surgery, what is the anatomy, how the tissue is behaving. So it's very difficult for AI to replace a human, especially a surgeon. Because a surgery, because there are more permutation combination, we are operating surgery at every time back of our mind. So many things are going. Okay, now this is the finding, we just change our plan. Okay, this is the finding, you change your plan.
Sure.
It's not a like flow chart. Suddenly you can't go through a flow chart. Otherwise you can't get those results.
Thank you, sir, for joining us and giving us this brief. Thank you so much.
In the ever-evolving world of healthcare, we need to be, as a surgeon, more smarter and more sharper. And with this motto, the 15th Sir Gangaram Hospital CME has been organized, and I am happy to be part of this. I am Dr. Vipin Tyagi, Senior Consultant Urologist, Kidney Transplant and Robotic Surgeon, and a Coordinator of Robotic Surgery Services in Sir Gangaram Hospital, and happy to be here.
Sir, as you've been operating for a long time and you've been wearing a lot of caps, from being a surgeon to a consultant to venturing into new technology from time to time, this is a very holistic question, not a very direct question to a doctor, but I would like to know, how do you keep the sanity of what your own USP is, and as a professional in the ever-changing time with technology?
I feel that a surgeon and a clinician need to be intelligent, and when I say intelligence, it means the skill of acquiring a knowledge and the skill of using that knowledge either medically or surgically onto the patient. Now, if you want to be smarter, then you should know how the future is coming ahead and how the technology is developing around your intelligence. So the technology become more like an assistance to us. It is not the main thing. It is more like a assistive technology which is making me more smarter to use my intelligence as a clinician and as a surgeon onto the patient. Like for example, robotic is a tool. It's a technology. But the surgeon who operates over the robot is the skill which I developed in my MS and my MBBS. The skill remains same. The tool of applying that skill onto the patient for the benefit of the patient and for the benefit of the surgeon also is different. So we cannot lag behind by just thinking, okay, I have acquired the knowledge of being a medical professional or a surgeon. I need to be more adaptive to acquire a technology and to make myself much more smarter, which is actually the theme of this CME, that how we can make ourselves smarter is to just use what we have in the knowledge box, and how can we increase the spectrum of this knowledge box for the patients.
Sure, sir. Thank you for your answer. I think it put a pause to my question, that how you can juggle between different roles, but hold on to your own roots.
Yes.
Thank you, sir.
We have to be the master, and the technology need to be slave.
Sure, sir. Thank you.
Thank you.
Thank you.
Hello. I am Dr. Kanavanan, Chairman Division of Pediatric Nephrology and Renal Transplantation, Institute of Child Health, Sir Gangaram Hospital. And today in this 15th SGRH CME, we had a discussion on multidisciplinary role in transplantation, and I spoke on pediatric renal transplantation. A couple of years back, pediatric renal transplantation was a dream, whether it can be done or not, whether an adult kidney can be put in a child's body or not, whether it will run or not, and whether can we cross some barriers, whether it's of the age or it's a blood group. And talking today, it's a reality that yes, it can be done. And in our hospital, we have done very young transplants, renal transplants, especially in children who are say around about 3 to 4 years old, weighing just 10 kgs. And we have also crossed the blood barriers as well. We have done ABO incompatible kidney transplants for almost 8 to 10 kids in our hospital, and they have been all doing very well. So yes, definitely we can put an adult kidney into a child, and they actually do much better compared to our adult counterparts if done pre-pubertal, that is before the age of say around 10 to 11. They will catch up with their height, they will have a normal life to live, and the best part is the quality of life becomes much better, not only for the child but also for the family. And the main thing is they come off the dialysis. So that is the best part that we have. And so to offer them a good quality of life, a child who is having a chronic kidney disease, end-stage renal disease, on dialysis, kidney transplantation is the way forward. Thank you.
Hello friends, I am Dr. Aditya Serene, consultant in the Department of Medical Oncology at Sir Gangaram Hospital, and today we are at India Habitat Center at Sir Gangaram CME, which is an annual event which we have been hosting for the past 17 years. Today is a very special day because we are seeing how artificial intelligence and technology is shaping even our own healthcare systems to improve the patient care delivery and as well as outcomes. So today again the main aim was to aware our own GPs and physicians so that they, because they are the first line for any patient referrals, so they should be well equipped with all the knowledge that we can give in a very simplified and take away home messages. I was really intrigued about the transplant panel, which inculcated all the possible transplants in one, all the possible consultants on one stage, and we are privileged to be working in the same institute. And my topic was focused on do miracles happen in oncology? Well, yes, and for the same thought process, we'll see you next year as well. Thank you.
Hi everyone, I'm Dr. Neeraj Dhamija. I'm surgical gastroenterologist at Sir Gangaram Hospital. And today we conducted our 15th annual CME of Sir Gangaram Hospital at India Habitat Center. The theme of the CME was AI in healthcare. So my job was to present a workshop, a mini workshop for general practitioners on how AI can be helpful in their daily needs, in taking clinical decisions, how they can use a particular AI model on the internet to generate some ideas, to take out some information. So I believe it was a very good interactive session. Though it was a first session, it was very well attended in the morning, and where we showcased not the presentation but the actual work of AI in generation of prompts and how we can use it effectively to generate some ideas. I believe every participation was, everyone appreciated the thing, and we have a lot of participation from all the consultants of Sir Gangaram Hospital. I would congratulate Dr. Manchanda on being the chairperson of such a widely well appreciated conference of this year, and a special thanks to our leadership, Dr. Ajay Swaroop and Dr. Rana, who have wholeheartedly supported us in organizing such a big event. I'm Dr. Neeraj Dhamija, and I'm here with Aarti ji.
Hi, I'm Aarti.
And Aarti was instrumental in taking all the bites from all the consultants who were there, invited a speaker or a faculty of Sir Gangaram Hospital. She did a marvelous job in this. And Aarti, what was your crux of knowledge being shared by all the speakers here for today's event?
Sir, too much of knowledge actually today. I was flabbergasted, let me tell you. Too much of medical knowledge coming to a marketer. But the crux was, and something very interesting I found in some of the communications, that what the myth is all around the world, that you know, if a AI or a robotic or a technology is going to come, we're going to lose the human touch, which is not that way. Each and every doctor I questioned directly or indirectly about technology, the fear of technology, they all said we want to embrace it. We want to be future ready. At Sir Gangaram Hospital, each and every doctor is very pro-learning any technology which is going to be there. and they're going to take it head on. So I was very happy to hear that nobody, not even a single person, told me that we are fearful. We are ready to take the challenge up. We are ready to learn. We are ready to take to the next level. And this was one of the biggest crux, because we were talking about AI, we were talking about robotics, we were talking about smart diagnostics. And I think each and every discipline doctor I spoke to today is touched by technology some way or the other. So it was a very enlightening and enriching experience, wherein I asked a lot of questions which was on the go or in the move, wherein I got very interesting answers also, and I met many doctors, which we don't do quite often in day-to-day life. And yes, it was a very, very enlightening session.
A good learning experience and interaction with all the doctors.
Yes.
And that is true. If you know the technology very well, then there is no need of getting afraid of that technology. You should know how to use that tool. So this is always said in our science, that a fool with a tool is still a fool. So you should be smart enough to use the technology, and AI is such technology, if it is used wisely and at all the checkpoints, that you should not at all 100% dependent on AI. You should also apply your mind in a particular case, in a particular patient, to get the correct diagnosis and to offer the patient correct treatment. These two things are very important.
And last not the least, which few of the doctors said, healing happens not only with machineries. Healing only happens with a human touch.
Yes.
So I think it's very important for clinicians to remain that, stay grounded, be what they are,
yes,
and be human to each and every patient. What our hospital also believes in: patient-centric, technologically driven, academically high. So I think today's CME has brought in all together, everybody's mind together, and I think the future is bright.
Yes,
the future is very strong, and we will keep going on the way we say trust of generations. We will have many more generations who will have trust in us and in our consultants. And that was a fantastic day which I had. And thanks to you and Dr. Sanjay Manchanda to bring me on board for this and to have this interesting sessions going on with us.
No, we are just the tip of the iceberg. The main foundation is being done by you people and the whole organizing team. And it was lovely interaction with all the general practitioner. I think these kind of interaction should happen all the time, and we should get more of such kind of interactions with the doctors of Gangaram Hospital. Since we are not into marketing very well, and we are not having a lot of funding for marketing, it is all self-driven or agenda-driven things. But yes, people like you are always helping us in keeping us at the platform, so that people should know us and they should come to the right people, right person for the right treatment.
So I think going forward, we look for more opportunities where we create these kind of platforms.
Yes, indeed.
Within the hospital, outside the hospital, and we tell the world that we are good, we will be good, and we'll always be good.
And we are always good.
Yes.
So Gangaram Hospital has remained as one of the benchmark institute where people see to it that they wanted to be part of this institute.
Yes, sir.
And we are blessed.
And we both are blessed at this point in time.
Yeah.
Thank you, sir. Lovely
Thank
interaction.
you, Aarti. Thank you.
Thank
Same
you, sir.
Hello, I am Dr. Deep Shankar Pruthi, an associate consultant in the Department of Radiation Oncology at Sir Gangaram Hospital, New Delhi. Today I am here attending the 15th annual CME of Sir Gangaram Hospital with the theme of Sharper Diagnosis and Smarter Management. This event has been very well attended from physicians all across Delhi, and there has been excellent academic discussions in which senior and even junior doctors from Sir Gangaram Hospital have shared their experiences regarding how technology has shaped their individual specialty, and this has given a unique opportunity for a healthy discussion, and we are helping create awareness how technology has shaped modern management. I am a radiation oncologist, and technology has made my specialty drastically change. Over the last 30 years, radiation therapy techniques have evolved. It is not just giving radiotherapy, it is actually precision medicine. With better technology, better imaging, we are able to preserve the organs, we are able to reduce the side effects of the patients, helping them get a better oncological outcome.
I am Dr. B.S. Vivek. I am a senior cardiologist and the director of the clinical cardiology and non-invasive imaging at the Ravira Heart Center, Sir Gangaram Hospital. So with this CME that I was a part of has been quite successful, and it was a very nice interaction with people who have come across the city, and the trained and the doctors who are practicing all sorts of branches, and it was really a successful outing as far as my topic and discussions around it were concerned. One thing that I would really like to convey to the masses is that the problems of the heart, especially the heart attack, is one such thing which has a lot of enigma around it, and I would request people first to try to prevent such thing to happen, that is, live healthy, eat healthy, go for a workout, and keep away from smoking and alcohol, etc. But once you do have symptoms which you feel that are not right, it's always better to reach the nearest hospital and seek medical help instantly, because in those stages, time is actually life. So don't be afraid of approaching a hospital if you have any pain related to the chest, especially from the lips to the navel, and especially if it is increasing on exertion. That is called angina, and that particular symptom needs to be taken care of. Eat healthy and stay healthy.
That's it.
Hi, good evening. Namaskar. We are both orthopedic surgeons from Sir Gangaram Hospital. I am Dr. Rajat Chopra, Senior Consultant.
I am Dr. Sarab Singh Sachdeva, Senior Consultant Orthopedics.
Right. So today we attended 15th CME of Sir Gangaram Hospital. It was very knowledgeable and it was a great experience for us. And we had presentations on avascular necrosis and its management, and the newer roles and the newer role of technology and medicine, how in a way that this disease can be managed better. Dr. Sarajit will talk about the newer technologies in AVN management.
Thank you. See, the AVN means the avascular necrosis of the femoral head. That means that the blood supply to the femoral head is compromised. Usually these scenes are seen in young adult population, maybe because of binge drinking, regular alcohol take, and in conditions where there is abuse of steroid. Especially we have seen this post-COVID where the steroids were prescribed and the patients are now landing up as a delayed complications of AVN. And traditionally in such cases the whole idea was to salvage the hip in a young person, because we do not have any medical treatment for that. So either we are able to delay it, or we are going to do a total hip replacement, which is not desirable in a young population. So traditionally we had been doing core decompression, maybe fibular grafting, and in recent times the people are coming with ideas of putting in plasma and sometimes stem cells also. And the recent development has been that we have been able to isolate osteoblasts, and the advantage of that is that instead of putting a whole plasma which contains everything and then putting inside in the target area, we are putting pure osteoblasts in the target bone area where the cells are dying, and we are expecting that thing to catch up and the bone degrowth is there and the hip is salvaged.
Thank you.
Namaskar, I am Dr. Nishant Wadhwa. I am a Senior Consultant and Chairman of the Division of Pediatric Gastroenterology, Hepatology and Liver Transplant at Sir Gangaram Hospital. I am here today attending the 15th Annual SGRH CME, and it's been a privilege and a mind-blowing experience for me, because here we have seen a culmination of cutting-edge technological advancements in medical field, meeting with the humane and empathetic touch of the seasoned doctors who have been working tirelessly at Sir Gangaram Hospital for several years now. It's been a learning experience also, because with the advent of AI and robotics and all the new inventions which have made the life of both the patients and doctors wonderfully simple and better, one also learns that how to use these technologies and how these technologies have helped us improve the life of both our patients as well as the caregivers, because we know that disease not just affects the patient but also the whole family. and with the coming in of these new age technologies, it has helped improve the quality care of these patients and help improve the prognosis and the results of various life-threatening disorders which were earlier considered inoperable or untreatable, and we are having such good results in improving the quality of life of our morbid patients. So I am really happy attending this 15th CME of SGRH, Sir Gangaram Hospital, and I would welcome many such interactions between the general practitioners and the specialists in the further years to come. Thank you.
I'm Dr. Roma Kumar. I'm a senior consultant clinical psychologist in the Department of Psychiatry and Behavioral Sciences, and I'm present here today at the 15th annual CME of Gangaram Hospital. And I see that today's discussions have been extremely great. What a wonderful CME that has been organized, and we've had speakers from all the disciplines, and it's been wonderful to be present here.
Hi, ma'am.
Hi.
As we've been discussing a lot of different panels and we're talking about different technology in the CME, how do you think your own discipline, where you specialize as, technology has been like a boom and you have accepted it, that's going to be the next level to reach your own patients?
Yeah, prior to COVID, we couldn't think that technology would be so great for our profession. COVID actually taught us to come online and give online therapy. And online consultation was not really very well talked of in the field of mental health. But now technology has actually helped us reach people in the smallest of cities and to the largest of towns and to various countries in the world. So we're taking therapies in various parts of the world, various timings, and I think it has also broadened that horizon that people can now connect with us and keep that confidentiality and not go and talk in open or go to the office and talk. So I think it's a very big beneficial thing that has happened.
Another question which will branch out from this, because you are in that mental space, because you are helping people who are having issues, they want to come back to you and discuss on different sessions and want to come up about depression or maybe some shock in their life or something they're dealing with. Do you really feel technology when you talk about online consultations or when you talk about technology on the phone maybe, does it lose any human aspect to your discipline?
Yes, it does. Sometimes it really makes us, a little on the edge, because sometimes it's imperative that we look at the patient, the body language, the connect and how the patient walks into your room, because in mental health it's important to see the person holistically and not just see the person in this level and talk on the audio or on the video. So we do feel sometimes that we need to see that part also.
So I will say, and I'll end this by saying that no matter how much technology, no matter how many AIs comes or robotics comes or different level of technology will come, that human touch is very important when it comes to a consultation or when it comes to a clinical practitioner to a patient, because that's more patient centric, and I think that also gives reassurance, a human to human.
I completely agree with you, because in mental health we're not only talking of illnesses, we're not talking there, we're also looking at conditions, and it's not like a chatbot that I'm talking of at XYZ online platform. But it's imperative that we listen to the client at a longer period of time and also help them process and give them some skill development on how to deal with their own life conflict. So it's important that technology and that touch, very important.
The balance is always important.
Absolutely.
Though technology will always help us to reach out to the patients in the most corner or the farthest of the places so that they don't deal what they're dealing separately.
Yeah, and it does help in a risky situation, because in COVID we actually helped a lot of people in the risk area that we were connecting on the on the screen, but it's important that we do see the client also.
Thank you, ma'am, for this lovely discussion.
Thank you.
Thank you so much.
Good evening. I am Dr. Rajesh Goyal, Senior Consultant and Vice Chairperson from Department of Psychiatry, Sir Gangaram Hospital. Today at this great event, 15th Annual Medicine CME of Sir Gangaram Hospital, I am so glad with the presence, the topics included and the speakers. I think almost The lot of medicine has been covered. So I feel this is a great day today.
Sir, you've been associated to the hospital for a long time.
Yeah, ma'am.
And this hospital holds a legacy of 70 years, almost 23 years of the Department of Psychiatry. I would love to understand or hear from you your views then when the psychiatric started at that time. People were not very well aware. People were holding back themselves more and they were never coming out. And today it's a very different world where cases are more, there are much more extreme cases. How differently we at Sir Gangaram take care of these kind of patients?
Ma'am, first thing, Gangaram is one of the very big private hospital. It is run by doctors itself. Everything is being taken care by doctors. So they understand everything. That is very important, ma'am. They understand patient as a whole. Holistic approach is there in Gangaram hospital to treat patient. So different departments. Suppose a patient goes to Department of Gastroenterology with a pain abdomen. After initial examination, when a clinician feels, yes, this patient is not suffering from gastrological problem, there is some psychiatric problem, they refer the patient to the psychiatric department. So that way, which is very rare in other hospitals, ma'am. Very rare. I am not saying that it's not there, but rare. Second thing, ma'am, such a big hospital having a DNB in psychiatry. I think a multi-specialty, such a big hospital is the only one in Delhi, Gangaram Hospital, which is having DNB psychiatry. Others are having, but they are not such big multi-specialty hospitals. So once you have a student with you, for a student you have to read every day, man. You cannot just go like that because your students will be asking questions. You have to take their exams, you have to conduct lectures, you have to conduct seminars, so many things are there. So continuously you have to read, so you are in touch all the new approaches and new things. Third thing, ma'am, our management teaches us slowly, everyone who joins Gangaram, slowly they come into a setting where you feel that you have to treat patient with a compassion. You have to understand. It is not only as a doctor, suppose somebody has come to me and he is telling his complaint and I am just as a doctor listening like that. That is not our teaching. That is not the setting here. As you asked that what is the difference between Gangaram Hospital. At Gangaram Hospital, mostly doctors will listen to the patient. They'll try to understand what problems he or she is having. So that is the best thing, ma'am. Most of the time patient tells us, Doctor Saab, पहली बार किसी ने ना बैठ के मेरी पूरी बात सुनी है. So this is very encouraging and very helpful, and this is a very big thing which makes Gangaram Hospital different from other places.
Sure, sir. Sir, how, I just want to understand, there was COVID, the time was COVID, then there were many other situations when a doctor is not approachable or reachable. And there are patients who are in a chronic condition or they are at the verge of doing something and they just want a desperate need. So, had technology helped you somewhere?
Definitely, ma'am. Before COVID, we were not allowed for online consultations. Just in 2020, I think 28th or 29th March, we were allowed to have online consultations. So, which changed the scenario a lot. Now our patients are in Nepal, parts of UP, Bihar, India, many times Australia, England, UK also. They arrange for medicines then with the help of some relatives. So they can talk to us, they can take their help. Otherwise, earlier it was like that, unless you are with the patient, you cannot write a prescription. So definitely this intervention, this mechanical help has changed lot many things.
Thank you, sir. This enlightens my knowledge also that how different our hospital is and how patient-centric our hospital is, that we as a family of Sir Gangaram,
yes,
alongside with management and consultations, work together for the same motive and objective to put the patient first rather than anything else.
That's why, ma'am, our motto is trust of generations.
Yes, sir. We stand very true to it. Thank you, sir.
Thank you.